Namaskar, a very good afternoon to one and all. A warm welcome. Right at the outset, I am grateful to all for having spared your valuable time and joining me on this platform. So, today I am going to talk about MPox, commonly which was called as monkeypox. I am sure many of you would have heard this name monkeypox, MPox lately, which is in a very limelight these days. Now, when we talk about MPox, basically it's an infectious zoonotic viral disease. When I say zoonotic, it means it is the disease can be passed from an animal to a human being as well. The disease has a similar presentation to smallpox, although of course less severity as compared to smallpox. Now, this virus was first discovered way back in 1958 in monkeys, which were being treated for a research purpose, and hence the disease virus derived its name as monkeypox, which lately in November 2022 WHO labeled is at MPox. So this is now the name of the disease is MPox. Now the first human case of MPox that was diagnosed and that was detected in 1970 in Democratic Republic of Congo in Africa. Now since then it has been prevalent in Africa, although the first outbreak of this disease was observed way back in 2003, where it was observed, outbreak was observed somewhere in outside Africa in USA. Now, when I talk about the global scenario, it has been documented now that apart from the African continent, the disease has traveled and has been observed in Europe also, USA, Germany, France, Poland, Portugal, and so even in the non-endemic areas also this disease have been found. When I talk about the Indian data, let me make it very clear that till May 2022, there was no single case of MPox in India. The first case of MPox in India was detected in July 2022. Since then, in India, about 30 cases have been identified, and the last case of MPox in India was detected in March 2024. When I talk about the global scenario, since 2022, globally, around about 99,000 cases of MPox have been diagnosed, over 116 countries, and out of which the mortality amount, that means the death, was around somewhere around in 208 cases. So when you look into the Indian data, as I said, the last case of MPox was detected way back in March 2024. But there has been an increasing evidence which has suggested that the disease is spreading even in the non-endemic areas also. Now, when we talk about the disease, the most important aspect is the causative organism of the disease. Now, MPox disease is caused by a virus which is a double-stranded DNA virus, and this virus belongs to the orthovirus genus, which is a family of the poxviridae virus. That's the technical detail with respect to the MPox virus I am talking about. Now, the host, the reservoir for this virus, yet it is unknown. However, what have been established is certain rodents, mammals, monkeys, rats, squirrels, tree squirrels, they have been found susceptible to this organism. So that is the host of this. During the course of the disease, when we talk about, one very important term we usually medically refer to is an incubation period of the disease. Now, what we mean by the incubation period is whenever a person is infected by the organism and the time taken for development of the first symptom, that is known as the incubation period of the disease. In case of MPox, what has been observed that usually the incubation period is somewhere around from 6 to 13 days. However, it has been even observed that it can vary from anywhere from 5 to 21 days also. The period of communicability of the disease. When I talk about the period of communicability of the disease, what has been established is it has been shown to be 1 to 2 days prior to development of rashes during the course of the disease to the total cure of the scabs or the total cure of the skin lesions. That has been termed as the period of communicability. I would like to underline here, ladies and gentlemen, the importance of this term. This period of communicability has such a significant importance because that is the phase when the person or the patient of this disease is infectious to any person who can come in contact of this patient. So this is the period of communicability. Now, a very other significant aspect with respect to this disease is the mode of transmission. How does the disease get transmitted? So when we talk about the mode of transmission, primarily there are two modalities, two modes of transmission. First is from human to human. That is, whenever a person comes in contact with a patient who has been suffering with this disease, a face-to-face contact or a touching the body or touching the skin lesions, or in a direct contact with the body fluids or the infected material, or even by an indirect contact of the infected person, thereby getting in touch with the contaminated materials, dressing materials, or the linen or the beddings. The person, this is one way of transmission of the disease. The second modality of transmission of the disease is through animals. It could be either through an animal scratch, animal bite, or eating of the meat that can also be responsible for transmission of the disease. Initially, as I had mentioned in my beginning, this is a zoonotic disease. The definition of zoonotic itself means a disease which can be transmitted to humans by animals. So the second important modality of transmission of disease is through animal bites or scratches. So this is the mode of transmission of the disease. Now, what are the clinical features of the disease? One very important aspect which I would like to underline here, audience, is that it is a self-limiting disease, usually lasting for about 2 to 4 weeks. I again repeat, it is a self-limiting disease lasting for about 2 to 4 weeks. More commonly, the serious disease or the gravity of the disease has been observed more commonly in children or in people who, and the gravity of the disease would depend upon the nutritional status of the person, associated comorbid diseases, and the immune status of the person who is affected. But commonly what has been established so far is the severity of the disease have been observed in younger children. Now, when we talk about the common symptoms of the disease, the clinical features, the first 0 to 5 days, what we call the prodromal phase, the commonest symptoms what are observed is fever, body ache, muscle pain, headache, skin rashes. So these are the patient can even present with sore throat, cough, and one important presentation is lymph node enlargement. Now this lymph node enlargement can be generalized either in the armpits, in the neck, or even lower down in the body, the enlargement of the lymph nodes. So that is known as the prodromal phase. Now as the disease progresses, after 1 to 3 days of the disease onset, what common symptoms are being observed, which are very significant symptom, and one of the important symptoms to raise a suspicion of the disease is skin rashes. Now this skin rashes could be vesicular, pustular, they may start as macular rashes, they may progress to papular rashes, vesicular rashes, pustular rashes as the disease duration progresses. Now, commonly what they have been observed is on the palms and the soles. However, they can affect the face also, they can affect the genitals also, and quite a few number of times even we can see these rashes affecting the eyes also. So they can affect the eyes also, the skin. That is a very, very important aspect. Again, the skin manifestations in the case of MPox, the gravity would depend upon the nutritional status of the patient, would depend upon the immune status of the patient, would depend upon the associated comorbid diseases the patient is already having. So that will decide the gravity of the skin manifestations. So that these are the most important signs, symptoms of the disease: fever, headache, myalgia, and skin rashes. And skin rashes which can be painful also, which can be very, very itchy also, which can show some discharges also. So these are the common symptoms which are in the case of MPox. Now, the importance of monitoring the patient of the MPox, one has to look into to prevent the complications. I am getting a number of questions here. I will attend all the questions later on, one by one, after we finish our presentation today. Thank you very much for a good involvement. So, as I was talking to you, what becomes when we talk about the disease symptom, it is very important to highlight the complications which can be seen during the course of the disease. The common complications which can be observed in the course of the disease is the skin lesions, or the patient can develop any form of a secondary infection. They can develop pneumonia, patient can develop a generalized infection, sepsis, and even and occasionally the patient can have a brain involvement leading to encephalitis. So, and as I already said, sometimes the lesion can affect the eyes, and if there is a corneal impairment, it can even lead to vision loss. So, pneumonitis, encephalitis, vision loss, generalized septicemia, sepsis, these are the common complications which can be observed during the course of the disease. Now, the most important question that really creeps up at this stage is, how do we diagnose this disease? So, diagnostic modalities are available. The virus can be isolated. A PCR test can be done to isolate the orthopox virus family, and once it is detected, a real-time PCR test can detect the monkeypox virus also. At the same time, the virus isolation and the next generation sequencing can also be done. At this point of time, the diagnostic facility, when I am talking particularly about our Indian subcontinent, is available at the testing facility of ICMR NIV Pune. So there are diagnostic modalities available which can categorically pick the virus and pinpoint and stem the diagnosis. So that is the diagnostic aspect with respect to the disease. Now, once the disease has been diagnosed, the most important and a very significant aspect which turns up is treatment, management of the patient. When we say management, it would include diagnosis also, it could mean treatment also, and very, very importantly, trying to prevent the complication. So the management treatment aspect of MPox rests upon primarily 4 or 5 main pillars, which would be isolation of the patient, protection of the skin, prevention of complication, rehydration therapy, treatment available for MPox. However, the antiviral treatment which was used for smallpox has been shown to be effective in few cases against MPox. But most important aspect when I talk about this is the first and the foremost is the isolation of the patient. Because as we have already discussed, the effective containment strategies are very crucial when we are dealing with the case of MPox. So isolation of the patient is very, very important, and the isolation of the patient has to last till the entire skin lesions have recovered totally, or all the scabs, they fall out. Till that duration, this patient has to be isolated. Any direct contact with that patient has to be avoided. The patients who have skin lesions, they have to be covered properly. So they have to be advised to wear full sleeves or full pants so that nobody comes into direct contact with those skin lesions. So that is an aspect of the isolation aspect. Rehydration therapy, trying to prevent the complications. When I talk about the prevention of the disease aspect, WHO has recommended a strain of vaccine against the disease. However, very significantly, I like to point out here, mass vaccination is still not being recommended. I still underline this fact. Mass vaccination is still not being recommended in case of MPox. So that is a very, very important aspect. Now, again, during the course of treatment and management of the patient, the monitoring of the patient, that becomes again a very, very important, significant aspect. When I talk about the monitoring, what is very important is we need to monitor for any eye pain or blurring of the vision, because if the eye is involved, that can lead to loss of vision. What is again important is we need to monitor for symptoms of shortness of breath or breathing difficulty, or any altered consciousness or sensorium, or any decrease in the urine output. So these are the very, very important aspects which need to be monitored during the course of the disease and with the patient, when the patient is under isolation and is being treated for that disease. Now, what is very, very important, as in the beginning I already said, the virus was isolated way back, and the first case was observed way back in 1970. Then why is this shout being done at this point of time? Why is the disease in the news? Because what has been observed is there is an endemic of the disease in the African continent, and that is why World Health Organization has declared this as a public health emergency. So what has been observed in particularly the Democratic Republic of Congo, they have thousands of cases which have been diagnosed with the disease, and the virulent strain which has been observed at this point of time has shown that mortality is slightly on a higher side as compared to the previous strain which were isolated. That is why this has been declared as a public health emergency by World Health Organization. When I talk about the Indian subcontinent, as I had already mentioned, the first case was detected and diagnosed way back in July 2022. After that, mere 30 cases have been isolated. The last was diagnosed way back in April 2024. So when we talk about the Indian subcontinent, a major outbreak of the disease, it seems very less likely in the disease. Particularly when I'm talking about to you with this season of monsoon ongoing, let me clarify and make it very clear at this point of time. Monsoon season has nothing to do with the outbreak of the disease. So this myth also needs to be dissolved. The seasonal variation does not have anything with the spread of the disease. So India at this point of time has a very low probability, low risk of outbreak of the disease. However, the authorities have taken due care of surveillance, and we are on a high alert, particularly on the entry points, so that as to avoid the spread of the disease. So when we talk about this, now what importance is the surveillance with respect to the disease. Now, when you talk about the surveillance, the first and the foremost aspect that turns up is identification and isolation of a suspected or a diagnosed case of MPox. That is very, very important. Providing the optimal clinical care to the patient, trying to prevent the complications. Contact tracing is again a very, very important aspect. Now, when we talk about contact, the definition of a contact would be any person either who has come in face-to-face contact with the infected patient, or who has come in a direct contact of the patient, or who has come in touch with the skin lesions, or even in contact with the infected material like dressing, soil dressing, or the bed linen or the bed sheets, they are defined as a contact. They also have to be monitored for minimum a period of 21 days. So this is a very, very important aspect. Again, a very important aspect when we talk about the surveillance is the protection of the health line workers. That becomes a very, very, and more importantly, effective control of preventing measures based upon identifying the route of transmission, the modality of transmission of the infection. So the surveillance aspect is also being taken well care by the authorities, and we as a nation are very, very high alert in this state. But again, at this juncture, what becomes very, very important is to educate the mass by and large, to make people aware about the preventive aspect of the disease, because to prevent the outbreak of disease, I, me, you, we all have to play our part. So collectively, if we resolve and come together, we can prevent the spread of this disease. That is a very, very important aspect. At the same time, when we talk about the disease, as I discuss about the disease, there is no place to panic with respect to the disease, particularly when I'm talking about the Indian subcontinent. However, having said that, I'll again like to add here, we all need to be careful. We all need to be careful, certainly not careless. You are pretty well aware there have been vaccines which have been established against diseases, but number of times again and again, I repeat, there is no vaccine against stupidity. There is no vaccines against stupidity. So collectively, we all have to play our role. We all have to follow the rules of the norms so as to we prevent the spread of the disease and we curb the menace of the disease which is striking our doors. But at the same time, having said that, we discuss about the symptoms, diagnosis, we discuss about the treatment. The first and the foremost part becomes the trying to prevent the disease, because as the age-old saying goes, prevention is always better than cure. I hope I have diluted a lot of myths and I have clarified a lot of things with respect to the disease, which is creating more of a mental traumatic havoc rather than a physical havoc at this junction. However, any other questions, they are always welcome, and I am very, very thankful to all for having spared your valuable time joining me on this platform this afternoon. Thank you very much. Namaskar. We have a number of questions which I'll attend one by one. One question says, what are the causes in MPox virus? What are the causes in MPox virus? What I would understand by this question is what causes MPox. So as we were discussing in our talk, MPox or the monkeypox, which was known as popularly monkeypox, MPox is caused by a MPox virus, which is a double-stranded DNA virus. So this disease is a infectious viral zoonotic disease caused by a virus. How long can an infected person remain infectious? This is a very, very important question. Once a patient has been infected with the disease, has been diagnosed with the disease, as we already discussed the aspect of the modalities of the treatment, the patient has to be isolated and all possible contact, direct contact or indirect contact with that patient has to be avoided. Now, the question is how long that patient may remain infectious. As long as there is no total skin layer clearing, as long as the patient doesn't get a fresh layer of the skin, or as long as all the skin lesions don't cure totally, or as long as the scabs don't fall totally, till that time this patient remains infectious and this patient has to be isolated. During the course of the time earlier also, I had discussed the same thing, what we call the period of communicability. So this is the period where the patient would tend to be infectious and hence this patient has to be isolated till there is a total clearance of the skin lesion or a new skin formation. this patient would tend to be infectious and has to be isolated. Do hospitals need to follow similar quarantine protocols as it was during the COVID? Again, a very interesting question here. It may sound like COVID, but this is certainly and absolutely different than COVID. But yes, when we talk about the preventive aspect, it probably the same logic, the same behavior, appropriate behavior applies in this disease also. Isolation, trying to prevent a direct or an indirect contact, wearing of a personal protection equipments also when trying to get in touch with the treatment, particularly when it applies to the healthcare workers. So when you talk about the quarantine purpose, the word quarantine is not coined here, but yes, what we advocate and what has been underlined again and again is a strict isolation of the patient. Can vector-like mosquito and common fly spread this virus? The question is, can vector-like mosquito and common fly spread this virus? The answer is big N-O, no. This disease does not spread by a bite of a mosquito or by a bite of a common fly. So they cannot spread this virus. There is one again interesting question in my hand. Does viral load play any role in assessing the state of infectiousness? Does viral load play any role in assessing the state of infectiousness? Now, with respect to the severity and the gravity of the disease, what has been established so far is the gravity of the disease, the seriousness of the disease would depend upon the nutritional status of the infected person, the immune status of the infected person, associated comorbid conditions or the diseases which the infected person is having. That would determine the gravity or the seriousness of the disease. However, what has been documented so far is the seriousness or the serious disease have been observed more in younger children as compared to adults. With respect to the viral load, so far the exact quantification of the viral load, testing modality for that has not been established. There are a lot of research still going on. Lot of research with respect to development of the vaccine against the disease is also going on. Maybe in due course of time we may get modalities to detect and which can help to determine the seriousness or the infectiousness of the disease. But at this stage, on the nutritional status, immune status, age of the person and the comorbid diseases, they can be determinant of the seriousness of the disease. Thank you.